guys, me Adam Deshaun here with another video. So this video is clearly impromptu. I'm sitting down here on the couch, having my coffee for the morning, and I was going through my social media and just reading some of the comments on some of my Instagram reels. So I think it's been over a month ago, I made this Instagram reel. It was basically saying that how nurses are basically having to do everybody else's job a lot of the times. And if any other department or anybody else's falls short, it falls on the nurse. And that reel stemmed from a night at work when we didn't have any CNAs. So the nurses had to be, had to do which is all patient care, but the nurses had to be the nurse and also do intimate care or CNA care or whatever you want to call it. Or just had to be the CNAs too for their patients. No nurses above this type of work, but the reason why you have CNAs is because you need CNAs. So, there wouldn't be a thing, if the nurse was supposed to do every single thing. So anyway, that particular night we didn't have enough CNAs, so the nurses were asked to just not have CNAs that shift. So later on that morning, the house supervisor calls up and says, the house supervisor calls up and says, can you guys try to see, can you get your morning labs because we're short on phlebotomists? So I was like, at that point, I was like, damn. So it all falls on the nurse, right? So I'm like, so we got to do the CNA job and we got to do the phlebotomist job. So it's like, the fuck? So I made this reel out of just being really frustrated with the direction that nursing is going. So a comment that somebody left on the reel, and I'll link the reel below to my Instagram. And those of you guys who have not already followed me on Instagram at Adam Deshaun. But the comment on the reel went something like, people as us as healthcare workers have to be mindful that we may be on the other side of the coin one day. We may be the one in that bed, and you shouldn't be doing the bare minimum, blah blah blah. First of all, let me just say this. Let's differentiate a healthcare worker versus a nurse. Yes, a nurse is a healthcare worker, but when you say healthcare worker to me, I think about anybody that works anywhere in the healthcare setting, be it in the kitchen, the janitor, the transport. I think of everybody as a healthcare worker. Yes, everybody does support patient care, but everybody is not directly responsible for that patient in their bed. So let me just say this. Let me differentiate that, because I don't like the way that they use healthcare worker and kind of scoop all that in with the nurse. That's not how it goes, okay? Because the nurse is ultimately responsible for the care of that patient in their bed. So if there's no CNAs, falls on the nurse. If there's not enough phlebotomists to come draw blood, there's still an order for labs to be drawn. So guess who has to draw the lab? The nurse does. So let me just get that out the way. But this is my point. And the title of this video is going to be hospitals and corporations need to stop holding nurses morally responsible. Because what's going on is that because nurses, I always say that nursing is an art. It's not a profession. It's not a job. It's not a career. Nursing to me is a calling. It is something that you really have to, for you to be an effective and just an amazing nurse, this is something that has to already be in you. You can't train to do this. Being able to care for a person is a calling to me. So when us as nurses are constantly being abused, and it's abuse, constantly having to do job after job because we're nurses, and and corporations and hospitals and institutions and facilities hold us morally hostage to complete these tasks for the same amount of pay that we're getting. Mind you, you're not compensating. You have CNAs on staff. So where my CNA check at? Because I'm CNA. You got phlebotomists on staff. So where's my part of the phlebotomist check? Since I'm doing that job too. But they hold us morally hostage because they feel like this is a moral job. We have a ethical responsibility to be nurses to patients, and we shouldn't be compensated for that. So they hold us hostage in that aspect, because when we come out and ask for more money, it's like we're being selfish, or we're not taking, like, it's a privilege, which it is. Don't get me wrong, nursing and being able to be a nurse is a privilege, but it's not a privilege for me to go out here and continue to put my licensure at risk, my patient's healthcare at risk, because every job that needs to be done ultimately falls on the nurse to do it. And nobody else is being responsible, because at the end of the day, if you don't have any CNAs, the nurse is still ultimately responsible to make sure that patient is clean, turned, and dried. If you don't have any phlebotomists on staff, it is still ultimately the nurse's responsibility to ensure that the labs that the physician has ordered are being drawn. So all of these things still falls on the nurse. So I'm gonna need y'all to get out, to stop trying to put this guilt trip on nurses just because we are asking to be compensated for every single job that we do. And it goes down to the housekeeper. I've been asked to clean rooms when the housekeepers are not available to get rooms clean because, admissions are overflowing in the ER. So it all ultimately falls on the nurse. And I really need people to stop holding nurses morally and ethically responsible for the lackluster administration. So that's it, you guys. Follow me on Instagram at Adam Sean. I will see you guys in the next video. Happy nursing. Bye-bye.